नमस्कार, वेलकम टू RCI नवशिखर चैनल। आप सभी का RCI के नवशिखर चैनल में स्वागत है। आज का हमारा चर्चा का विषय है डेवलपमेंट ऑफ स्पीच एंड लैंग्वेज, एंड फॉर दिस डिस्कशन वी हैव एक्सपर्ट मिस नियति। शी इज स्पीच पैथोलॉजिस्ट एंड ऑडियोलॉजिस्ट। शी विल बी डिस्कसिंग अबाउट दिस टुडेज टॉपिक ऑफ डिस्कशन। मैं अपने व्यूअर्स को बोलना चाहूँगी, उनके इस रिगार्ड में जो भी क्वेश्चंस हैं, क्वेरीज हैं, अपने केसेस डिस्कस करना चाहते हैं या अपने व्यूज़ देना चाहते हैं, तो हमारे टोल फ्री नंबर पे कॉल कर सकते हैं। हमारा टोल फ्री नंबर है 1800112008 265111613। हमारा फैक्स नंबर है 265111609। टाइम टू टाइम आपकी स्क्रीन पे नंबर्स फ्लैश होते रहेंगे, तो आप हमें कॉल कर सकते हैं और हमारे एक्सपर्ट से बात कर सकते हैं। तो आइए हम अपने डिस्कशन आज की स्टार्ट करते हैं। वेलकम मैम।
गुड आफ्टरनून
मैम, जैसे कि हम जानते हैं कि आज का हमारा टॉपिक ऑफ डिस्कशन है, इट्स मेनली फोकसिंग द डेवलपमेंट ऑफ स्पीच एंड लैंग्वेज। और हम लोगों को पता है कि इफ़ यू वांट टू टॉक टू अनदर पीपल, तो उसमें हमें डेवलपमेंट ऑफ स्पीच एंड लैंग्वेज होना बहुत ज़रूरी है, एंड इट्स वेरी मच इम्पॉर्टेंट पार्ट इन एवरीबडीज़ लाइफ। तो हम इसके बारे में जानना चाहेंगे कि किस तरीके से स्पीच एंड लैंग्वेज डेवलपमेंट हो सकती है।
द फोकस ऑफ दिस पर्टिकुलर presentation is also to highlight not only the development of speech and language. Now why do we want to highlight it is because आजकल speech and language problems का awareness is tremendously increasing amongst parents, amongst teachers, amongst children, and prevalence also is increasing because there are so many reasons जिसकी वजह से speech and बच्चा कई बार देर से बोलता है या उसको correct stimulation नहीं मिलता है, so parents are at they are not able to account for कि उनके बच्चे को स्पीच एंड लैंग्वेज डिले क्यों है
जी।
तो और आप डिले कैसे बता सकते हैं when you have to know the normal concept. So when you know how the normal speech and language development takes place, then only you can explain
जी।
this is disordered and this is normal. So that is why I wanted to highlight on the normal speech and language development. Now we'll begin first with the development of, first we will know what is speech. Speech refers to the sounds that come out of our mouth and take shape in the form of words. Humans produce both consonant and vowel sounds, and the children learn to produce at least 16 vowel sounds and 24 consonant sounds. This is according to the English language, and we know कि as in our Hindi language
जी।
स्वर और व्यंजन का कॉन्सेप्ट रहता है, तो 11 स्वर और 33 व्यंजन रहते हैं. तो स्पीच इज समथिंग जो हम बोलते हैं हमेशा, और जो आपके मुंह से वर्ड्स निकल रहे हैं किस तरीके से निकल रहे हैं, आप उनको करेक्टली बोल रहे हैं कि नहीं, दिस इज स्पीच. ऑफन इट हैज़ बीन ऑब्जर्व्ड कि even professionals are confused regarding what is speech and what is language. So I would like to differentiate between speech and language here.
जी।
As I explained, speech is the output form जो आपके articulators final form जो produce करते हैं, which is audible to the listener, is your speech. Now let's look at what is language. Language refers to the content of what is spoken, written, read or understood. Language can also be gestural or when we use body language or sign language. It is categorized into receptive and expressive language. So the content of what we want to speak refers to language. आपके दिमाग में एक idea आता है, एक concept आता है, and you want to express that idea. That whole content is referred to as language. आप सोचते हैं, दिमाग में फॉर्मुलेट करते हैं कि क्या बोलना है इस टाइम. नाउ आई एम टॉकिंग टू यू, तो आई एम फॉर्मुलेटिंग इन माई माइंड कि व्हाट शुड बी द कंटेंट ऑफ व्हाट आई एम स्पीकिंग. दिस इज लैंग्वेज. और जो आपको सुनाई दे रहा है वो मेरी स्पीच है. So this is the difference between speech and language. Now language is further divided into two components, receptive and expressive language. We'll look into what is receptive language first. Receptive language refers to the ability to comprehend and understand speech or gestures. Receptive language is the input system of language. It is what we see and hear and the information that we take in. That is the comprehension of information. So receptive language basically means कि आप कितना समझ सकते हैं. आपके environment ने आपको कोई input दिया है, how well can you understand it? Not only in terms of speech but also in terms of gestures. So receptive language basically refers to the input system of language. What do we mean by input is कि आप कितना समझ पा रहे हैं. जो भी verbal, audible, gestural information आपको environment से मिल रहा है, आप उसको कितना समझ पा रहे हैं refers to your receptive language. अब जैसे कोई बच्चा आपके पास assessment के लिए आता है, एंड यू आर गेटिंग कन्फ्यूज्ड बिटवीन रिसेप्टिव एंड एक्सप्रेसिव. सो रिसेप्टिव होगा कि वो कितना जानता है, वो नहीं कि जितना बोल पाता है.
जी.
जितना समझ सकता है वो बच्चा, आपने कोई क्वेश्चन पूछा, आपने कुछ वर्ड का मीनिंग पूछा, वो कितना उस चीज़ को समझ सकता है, दैट इज रिसेप्टिव लैंग्वेज.
मीन्स रिसेप्टिव मतलब कॉम्प्रिहेंशन, कितना समझ पाते हैं. अब
Exactly.
जैसे यू आर गिविंग द व्यूज रिगार्डिंग दिस डेवलपमेंट ऑफ स्पीच एंड लैंग्वेज, और इतना ये डिपेंड करता है कि व्यूअर्स हमारे कितना उसको समझ पाते हैं.
वही रिसेप्टिव लैंग्वेज
जी.
एस्पेक्ट है. नाउ लेट्स सी व्हाट इज एक्सप्रेसिव. Expressive language refers to the ability to formulate and express wants, needs, ideas, and opinions. Expressive language is the output system of language. It is the expression of communication. So expression basically means कि द आउटपुट सिस्टम ऑफ द लैंग्वेज. हमने जो आइडिया फॉर्मुलेट कर लिया अपने माइंड में, अब हम उसको बोल के एक्सप्रेस कर रहे हैं सो दैट द अदर पर्सन कम्स टू नो अबाउट इट. नीडलेस टू से एक्सप्रेसिव लैंग्वेज ये ही मीन नहीं करता है कि जो आप वर्बली बोलते हैं और ऑडिबली सुनते हैं. इट कैन बी जेस्चरल वेज ऑल्सो. इट इज़ जस्ट दैट आई एम कम्युनिकेटिंग व्हाट आई एम फीलिंग. जब मैं उसे एक्सप्रेस करती हूँ तो वो हमारी एक्सप्रेसिव लैंग्वेज बन जाती है. So language is a unit. Receptive language is the input in the form of environmental gestures या audible या verbal messages जो कि आप समझ पाते हैं. And expression refers to आप उसको कितना समझ के और आपको जब बोलना है तो आप कितना उसको बोल पाते हैं. That is expressive language.
Means it's a kind of output
of the language system.
जी.
That's correct. Now these are the two subdivisions of language. Now, language is further divided into three aspects, which have been stated by Bloom and Lahey in 1983. Now, these are content, form, and use. Now, we'll see what is content, form, and use. Content refers to the semantics, that is the words and the meanings. मतलब आप जो आप बात कर रहे हैं, उस समय मैं जो वर्ड्स यूज़ कर रही हूँ, आपसे बात कर रही हूँ, तो उन वर्ड्स का क्या मीनिंग है, दैट रेफर्स टू कंटेंट, जो कि हमारी स्पीच को कंप्राइज करते हैं, जो वर्ड्स और उनकी मीनिंग्स. तो द ब्रांच ऑफ linguistics that deals with the study of words and its meanings refers to your semantics, and this forms the content aspect of language. The second aspect is form. Now form refers to the syntax. We say syntax or phonology. Now we know syntax is the study of the structure of sounds, as in the order in which you are speaking, the order in which the words are arranged in particular language. Then other concepts such as the plurals, the prepositions जो आप और further additions अपने words में करते हैं, that is forming the part of syntax. So basically semantics is the word and the meanings, and syntax is the order of the words in a particular sentence, and it also comprises of the speech sounds overall. Phonology deals with that. And finally is the use, which is referred to as the pragmatic aspects. Now this refers to the social use of language, how you, in what situation, how you have to speak, what words you have to use, how formally you have to speak. This comprises the pragmatic aspects of language.
Is this the sequential component factors that are included in development of speech and language?
No, this is not sequential. All these are simultaneously taking place. A child learns few words, उनके मीनिंग्स डिराइव करता है, कुछ अटरेंसेस उसके मुंह से निकलते हैं, दैट इज सिंटैक्स. एंड सबसे पहले डेवलप होना शुरू हो जाता है प्रैग्मेटिक्स. प्रैग्मेटिक्स बेसिकली इज इन व्हाट एनवायरनमेंट, हाउ यू परसीव इट एंड हाउ यू मॉड्यूलेट योर आउटपुट अकॉर्डिंग टू दैट इज प्रैग्मेटिक्स. तो बच्चा, अगर उसको पता है, छोटा बच्चा भी है, अगर वो बोलना नहीं जानता है, फिर भी ही नोज कि अगर वो रोएगा तो उसकी मम्मी को समझ में आ जाएगा कि ही इज हंग्री. सो दैट इज प्रैग्मेटिक्स. He knows that if he'll cry, his mother will come to know that he wants food or he needs water. So this is the intent of communication which deals with pragmatics.
मतलब हम कह सकते हैं कि it is the adaptation to the situation.
नहीं, adaptation नहीं कहेंगे इसको ये कहेंगे कि आप you know how to manipulate the environment or you are manipulating yourself according to the environment. आपको एडजस्ट करना है अपने environment में. Either that is through speech or that is through your action. That is pragmatics. Now let's see further what are the precursors to language development. First of all, a person should have normal hearing abilities. The ears must hear intonation patterns, accents and the sentence patterns. तो language development के लिए कुछ चीज़ें are very important. One of them is normal hearing abilities. A person should have normal hearing. जब एक इंसान की सुनाई normal होगी, सही होगी, तभी वो हर वर्ड को, हर सेंटेंस को, हर एस्पेक्ट को सुन पाएगा. जब वो उस चीज़ को सुन पाएगा तो ही तो लैंग्वेज डेवलपमेंट होगा. जो चीज़ हम नहीं सुन सकते वो हम कभी बोलना समझना सीख नहीं सकते. सो हियरिंग इज़ द फर्स्ट स्टेप. अ पर्सन शुड बी एबल टू हियर ईच एंड एवरीथिंग, and this will lead to further development of speech and language. Now the second component along with the hearing abilities is the brain must have enough intellectual capacity to process what those words and sentences mean, and it should be able to store all of this information so that it can be retrieved later. So to put it in simple terms, हमारे कान कुछ सुनते हैं, वो information is given to the brain. Now the brain or the intellectual capacity should be normal to understand what information has been given to us. Not only should it be normal in understanding the information, but at the same time it should be able to store the information that has been received. अब वो information वो store करेगा so that later on when we need to speak, we can retrieve the information from the brain and learn to speak and express our ideas.
That means we can say the whole process, the input, processing and the output, it should be proper.
Yes.
क्योंकि अगर एक फैक्टर इसमें मिसिंग होगा या ठीक से वर्क नहीं कर रहा होगा
तो it will affect speech and language development. So it goes very step by step. First step is hearing itself, which is at the level of the ears. When you hear something, if you're not hearing, then the speech and language development is affected. The second step is at the level of the brain. आपको जो information आ रहा है,
that
you
is
are
being
understanding
processed
and you are storing that information.
जी.
The third aspect is the brain then must recreate words and sentences heard previously when it wants to communicate an idea. And so that means कि not only the brain should be able to store the information, but इतना intellectual capacity develop होना चाहिए कि we know that whenever a situation arises, we can recreate those words and sentences to express what we need or what we want. And the next precursor is the child's physical ability to speak for the words to be heard or understood when used. That is the functioning of the articulators. So if you see, what we are going through is once first we are hearing, then we are processing what we have heard, and now is the time to speak. So for the speaking part, we need that the articulators should be intact.
जी.
So the whole process of hearing, listening and speaking is very intertwined. It's very connected. On top of it, there are other factors also, like they must have the psychological or social need and interest to communicate with others. They must be put in a situation wherein they need to indicate their emotions, their wants and needs. अगर एक बच्चे को आप एक opportunity नहीं देंगे to interact with anybody, आप उसकी needs बिना उसके कहे fulfill कर देंगे, then he does not feel the urge to come out and express what he wants. So that is where speech and language again is hindered. So most of the time now we see in the present scenario, what happens is parents do not have enough time. So बच्चे के बिना कुछ मांगे ही every need is fulfilled, and then they come to the speech therapists like us and they complain that the child is not speaking, though everything else is normal. Why the child is not speaking? Because that particular opportunity itself was not given to the child. वो बहुत important है कि parents को आप काउंसिल करें कि you give the child the opportunity to interact. If you fulfill all the needs, it is as simple as understanding it like this, that if we don't need to work and we get money, then we will never go to work. अगर हमें घर बैठे ही अपना सैलरी मिल जाएगा, then why will we feel the urge to work? So similarly with the child, the act of speaking is complex. Why will he need to indulge himself in such a complex act when his needs are being fulfilled without doing anything?
जी.
So that opportunity needs to be given to the children. So if this opportunity is not given, then also speech and language development can be affected.
मैम, जैसे आपने यहाँ एक पूरे प्रोसेस की बात करी कि किस तरीके से हियरिंग नॉर्मल होनी चाहिए, दैट इज एक्टिंग एज अ इनपुट पार्ट, और फिर उसके बाद पूरा प्रोसेसिंग होता है और सिचुएशन के अकॉर्डिंग वी आर एक्टिंग, और आर्टिकुलेटर्स जो है हमारे उस हिसाब से एक्ट करते हैं. तो इधर वी वुड लाइक टू नो व्हाट आर द आर्टिकुलेटरी ऑर्गन्स एंड हाउ दे वर्क.
Okay. The articulators basically refer to the parts of your oral system that are movable. Movable parts में it includes your jaw, your tongue, along with that the teeth, the lips, the soft palate and the hard palate. So ये oral structures are responsible for producing speech. अब जब हम different oral structures such as your lips, such as your teeth, your tongue, इनका movement alter करते हैं तो different speech sounds are produced. So these are the articulators that shape the voice that is produced at the level of the glottis, और वो
जी.
words इस level पे आके बनते हैं. So these are the articulators which are responsible for production of speech, and they should be intact for expressive language as well as speech.
जी. So every alphabet and different words must be having different articulatory organs.
Yes, definitely. So different वो words इसीलिए produce होते हैं because their articulators are moving in different positions,
जी.
and that is why that particular word is produced. If I give you an example, I'll produce ah with an open mouth. But if I close my mouth, if the lips are closed down, ooh, it becomes ooh. तो वही इन articulators की shape का change होता है, तभी different words and sounds are uttered by a person.
जी.
Along with these, it's important to reinforce the attempts at communication. कई बार क्या होता है कि the child is talking to the parent is not interested, they don't have time, and so they cannot respond back to the child. This also diminishes their ability to communicate. तो अगर बच्चे को उस टाइम पे reinforcement मिले, that parent say that okay fine, what you are saying, आपकी बात सुन रहे हैं, या they respond appropriately to the child, this gives him the boost to further talk. This reinforces his attempts at communication, and he feels कि if ज़रा सा communicate, if he makes an effort to communicate, if he speaks something, then his needs are fulfilled. Then the encouragement is given for the development of speech and language. The child begins to speak more and more as he sees that his attempts at communication are being reinforced. So this is what were the precursors to language development. Now we further will see process known as listening. Now what is listening? It is an active process of hearing and processing to comprehend what is being said. Listening is what the brain does with what the ears hear. So listening is a very important part. Hearing, as I said, was just hearing, आपको information आ रहा है, आप सुन रहे हैं. But listening means जब आप उस information का meaning derive कर रहे हैं, which is equally important, and it integrates both hearing as well as the intellectual capacities of the brain.
Like our teachers says in the class कि listen carefully.
Yes, exactly. Why do they say listen carefully? Is you have to integrate both hearing as well as your brain, and attention is paid to whatever is being taught, and so this way not only academic development takes place but also the normal development of language. Actually speaking, the normal language development takes place through listening. Once a child hears something, he tries to associate a meaning in the brain, and then only he learns to express it. So it is an integrated part of the language and the speech development. Next, we will like to see why is listening important. It provides the foundation for processing speech and language development and learning, and it involves the skills of auditory perception and discrimination, immediate memory, auditory attention, auditory closure, auditory association, auditory comprehension, and cohesion. So as it is written that it is a foundation for processing of speech and language development and learning. It is the basic precursor for developing various concepts, cognitive concepts, as well as your academic concepts. And it says that it involves the skills of auditory perception, that is whatever you are perceiving auditorily. Then discriminating between different sounds. This is the way this particular sound is sounding, this is the way this particular word is sounding, उनके बीच में differentiate करना. Then auditory closure, half of the information is given to you, then how do you integrate it with the, sometimes it happens कि half of the information is given and rest of the information you need not require because you integrate it.
We are deriving the meaning from the previous thing.
Yes. और आपने previously आपके साथ कुछ ऐसा experience हुआ and you know that okay इसके बाद ऐसा ही होगा, so you
association
can
is there.
Yes, exactly. Now we will see what are the additional language precursors. These develop from birth to between 18 and 24 months and are divided into 3 skills: cognition, communication development, and sound production. Now cognition refers to thinking skills. For children at a pre-language level, thinking skills develop by using and playing with toys and other objects. So cognition is a major precursor for language development. हम पढ़ते भी हैं cognitive prerequisites for language development. If cognitive concepts are developed at a at an appropriate age, then the child begins to speak and understand speech as well according to the normal age.
So we can say that all the factors like listening, cognitive skills are very much associated with the development of speech and language that we are discussing with our expert. We will be discussing more about this after this short break.
The chief handicap of the blindness is not blindness, but the attitude of seeing people towards them. आइए जानने और समझने की कोशिश करते हैं कि बधिरांधता यानी डेफ ब्लाइंडनेस क्या है। बधिरांधता एक स्थिति है जिसमें दृष्टिहीनता एवं सुनने की शक्ति में कमी आती है तथा जिससे विचारों के आदान प्रदान और रोजमर्रा की आवश्यकताओं की पूर्ति में समस्या उत्पन्न होती है। बलराम एक 9 साल का बधिरांत बच्चा है। वो एक प्री मैच्योर बच्चा है जिसका शारीरिक विकास उसकी आयु के अनुरूप नहीं हुआ था। वो एक निम्न वर्गीय श्रेणी से संबंध रखता है तथा 5 साल से लगातार नेशनल एसोसिएशन फॉर ब्लाइंड दिल्ली के प्रशिक्षण कार्यक्रम से संलग्न है। इन 5 सालों के अंतर्गत उसे रोजमर्रा के कामों में, हलन चलन में, उसकी शैक्षणिक जरूरतों के अनुसार संप्रेषण द्वारा प्रशिक्षण दिया गया है जिससे वो इन सब क्रियाओं में स्वावलंबी बन सके। बलराम बिना किसी सहायता के चाकू से फलों को काट सकता है। उनके छिलकों को कूड़ेदान में डाल सकता है। अपने बर्तनों को खुद साफ कर सकता है। उन्हें सही जगह पर रख सकता है। सही बर्तनों का चयन करके खुद खाना खाता है। एवं पानी की बोतल निकालकर पानी भी पीता है। इन सभी क्रियाओं में वो टेक्चुअल साइन लैंग्वेज से निर्देशों को ग्रहण करता है और अपने भावों को व्यक्त करता है। टेलर फ्रेम और ब्रेलर द्वारा गणित, पठन लेखन में भी प्रशिक्षण प्राप्त कर रहा है। सभी बच्चों की तरह उसका भी एक मनपसंद खेल है। उसे सेल फोन को अपने कानों पर लगाकर उसका कंपन महसूस करना अच्छा लगता है। कहा जाता है, वॉकिंग विद अ फ्रेंड इन डार्क इज बेटर देन वॉकिंग अलोन इन लाइट। कहने का तात्पर्य है कि वो लॉन्ग केन ट्रेवल, टैक्टाइल पाथ, ट्रेलिंग और लैंडमार्क्स द्वारा हलन चलन में भी सक्षम है और व्यायाम संबंधी क्रियाएं जैसे ट्रेडमिल, स्टैटिक साइकिल का स्वचालन भी कर सकता है। कहा गया है, द बेस्ट एंड मोस्ट ब्यूटीफुल थिंग्स इन द वर्ल्ड कैन नॉट बी सीन और इवन टच्ड, दे मस्ट बी फेल्ट विद द हार्ट.
Welcome back to our discussion. We will be discussing more skills about the development of speech and language with our expert.
Okay, coming back to the cognitive skills that we were dealing, first we were talking about cognition. It refers to the thinking skills. So as we discussed, this is at the pre-language level. बच्चे का cognitive skills, how can you improve by playing with toys and other objects? So this really works for improving the cognitive skills of the child. Then next aspect is object permanence. Now object permanence basically refers to the fact that the child knows that something exists even though it is out of sight. As example is given कि अगर एक बच्चे के सामने आपने doll रखा है and then you just hide the doll and the child still knows that the doll exists and he tries to search for it. So this refers to object permanence. These are all small cognitive concepts that first develop in a child before the development of actual speech and language. These are equally important because they lay the foundation for the development of speech and language. So after object permanence, we see there is another cognitive skill, that is means and ends. Means and ends refers to the ability to use their bodies or other objects to get what they want. For example, if the child sometimes indulges in activities like they will pull your hair, or they will drag you towards whatever objects they would like to obtain. So they know that if I want something that is kept on the shelf which I cannot reach to, I have to call my mother. So they know that in order to get something, I have to do this. So this is means and ends relation. Now later on, how this is manifested is in terms of speech. अगर मुझे कुछ चाहिए, अब मैं बोल के आपसे मांग रही हूँ, this is the basis, this means and end relation is the basis of my speech development. If I know that I can achieve my means, if I can achieve my objective of speaking to you about speech and language development, if I'm able to do it and I know that I can do it via presentations and talking about it, this is means and end relation, which is manifested in the terms of speech. Next ability is cause and effect. Now cause and effect refers to a child's ability to use objects to create interesting events, signs and sounds. Early developing cause and effect skills are developed with the use of toys. Example, shaking rattles or squeezing toys. So they know that एक अगर ऑब्जेक्ट को हम cause and effect relationship basically means कि if I do something like this, the end result will be this. So if early cognitive concepts में वो ऐसे manifest होता है कि okay, the child knows that if I squeeze one toy that it will make sound. So this is the your cause and effect relation, that they know कि अगर मैंने ये काम किया तो इसका end result ये होगा. So all this, if you see, if you try to apply in your normal speech and day-to-day speech, you will come to know about it. अगर आपको पता है कि you want to talk to your teacher and so you know that in order to make her or him help me, I need to be soft spoken, I need to work a lot. तो ये है आपका cause and effect. अगर मैं अच्छे से सारा assignments अच्छे से सारा काम करूँगी तो फिर I know that my teacher is going to help me or it is going to yield me good grades. So this is also a manifestation of your cause and effect relationship.
Ma'am, like we are discussing about the different cognitive skills and the factors that are helpful in developing speech and language. तो यहाँ पे जैसे हमने कई बार सुना है कि speech and language जो बच्चे की है, either it's deviated or delayed. So we would like to know about this, the deviated and the delayed language.
The deviated and the delay language, this concept we will deal in the due course of time, because first I want to highlight what is normal.
जी
एक बार नॉर्मल हम समझ लें, ये तो एक कॉग्निटिव प्रिकर्सर्स हैं जो
जी,
लैंग्वेज
जी।
डेवलपमेंट में हेल्प करते हैं. तो इफ़ दीज आर नॉट प्रेजेंट इन अ चाइल्ड, अगर उसको कई बार इफ़ यू सी चाइल्ड हु हैज़ लो इंटेलेक्चुअल कैपेसिटी, उनमें ऑब्जेक्ट डोमिनेंस जैसी स्किल्स नहीं होती हैं. That you hide an object, so they feel that out of sight is out of mind. So these all aspects are early on manifested in children
So
who
these are
have
the
delayed language.
prerequisites we can say for the development of proper language.
Speech and language,
जी.
definitely. अगर ये वाले skills are developing in a child, they are the foundations on which our speech and language development is based.
जी
So if you see early on in a child, if he or she does not exhibit object permanence, यानी आपने कुछ छुपा दिया और वो नहीं उसको ढूंढने की कोशिश करते हैं, या फिर दे डोंट नो कि इफ़ आई हैव टू गेट वन पर्टिकुलर ऑब्जेक्ट देन आई हैव टू आस्क द मदर, और आई हैव टू मेक सम साउंड सो दैट आई डाइवर्ट द अटेंशन. दीज आर द अर्ली ऑन साइंस दैट द चाइल्ड मे हैव स्पीच एंड लैंग्वेज प्रॉब्लम्स. We'll see another one, that is object use. Object use refers to a child's ability to manipulate objects. That is, a child knows that if this object is mouthing of objects is a way to explore. So what they are basically trying to say is, initially जब आपने देखा होगा नॉर्मल डेवलपमेंट में क्या होता है, बच्चे को जब नहीं मालूम होता है कि इस एक पर्टिकुलर ऑब्जेक्ट का यूज़ क्या है, तो दे ट्राई टू फर्स्ट थिंग इज दे विल टेक इट टू देयर माउथ. तो धीरे धीरे विद देयर एक्सपीरियंसेस दे रियलाइज द यूज़ ऑफ ऑब्जेक्ट. सो फर्स्ट दे वुड लाइक टू एक्सप्लोर इट. सबसे पहले तो माउथिंग होता है, उसके बाद दे वांट टू एक्सप्लोर इट फिजिकली, दे वांट टू फील द फीचर्स एंड दे वांट टू फील द फॉर्म ऑफ द ऑब्जेक्ट, एंड देन इवेंचुअली थ्रू दिस दे लर्न द यूज़ ऑफ द ऑब्जेक्ट्स.
वॉट इज़ द अप्रोप्रिएट एज जिसके लिए हम कह सकते हैं, जैसे माउथिंग है, तो हम कितने एज तक हम कह सकते हैं कि बच्चे को इसके बाद नहीं करना चाहिए ये मैच?
Till 1 year, it is normally observed the children still indulge in mouthing. They do not have the concept of edible and non-edible substances. तो वो हर चीज़ मुंह में डालते हैं. So till 1 year, if this exists, it is all right. But अगर एक साल से भी ज़्यादा बच्चा हर बार यही करता है, mouthing करता है, that means there is some issues, and the issues could be the cognitive capacities. Maybe the child has some amount of retardation. That is why they are still not able to go beyond that mouthing stage. So the next stage after mouthing is the actual exploration of the object. और आपने विजुअली इम्पेयर्ड में भी देखा होगा दैट देयर सेकेंड स्टेज से वो थर्ड स्टेज में जाना, दैट इज़ एक्चुअल यूज़ ऑफ ऑब्जेक्ट रियलाइज करना लेट होता है, बिकॉज दे आर स्टिल एक्सप्लोरिंग द ऑब्जेक्ट फिजिकली, बिकॉज दे कैन नॉट सी इट. So they have less amount of sensory information to know about the object, and then after that, when they are still in the exploring phase, when the other children, normal children, have gone on to the phase of using the object. So ये छोटी छोटी चीज़ें हैं जो आपको हेल्प करेंगी आइडेंटिफाई करने में कि वेदर डिविएंसी एंड डिले
जी
बच्चे में हो सकता है या नहीं. Coming on to the social communication development, children communicate to satisfy wants or needs, to control someone or direct someone's attention, establish or maintain social contacts, express feelings, and respond to their surroundings. And the skills that they use in this early communication development comply of sound, that is crying. We know that crying is the most powerful way to communicate, and the early communication effort of crying is reinforced as the babies are fed, picked up, or changed. Infants soon learn to make sounds when someone talks to them, when they see a familiar adult, or when they want attention. So the early communication development में हम कहते हैं कि बच्चा सिर्फ आवाज़ें निकालता है. They make use of sounds and they indulge in behaviors called cooing. वो सिर्फ आवाज़ें निकालता है so that he directs attention. सबसे first step is he just makes a sound and he knows that a parent will come or the caregiver will come to attend to the child. Later on they learn to indulge in cry behaviors. To express their pleasure or their displeasure, they will indulge in cry behaviors, and धीरे धीरे they will try to indicate their needs and wants by crying. And differential cry patterns are also being seen कि भूख के लिए अलग तरीके से रोते हैं और उनको कुछ और नीड होती है, so they cry in a different manner. So the first step in the development of speech is cooing. That is, they indulge in vocal play. They make use of a lot of sounds and they cry, and and the whole requirement is, the whole purpose of this act is to indicate what they want.
जी.
Again, the pragmatic aspects come into the picture, that they want to get something, and because of that they are indulging in a behavior such as crying.
And they are expressing it differently for the different their needs.
Yes, small children cannot speak, so obviously they will make use of first step, that is going or crying. Second skill is the facial expressions. That is, the eye contact between babies and their caregivers is a very early way to communicate. Smiling is an important response for developing interaction. Eventually, babies develop facial expressions to indicate when they are happy, sad, angry, and excited. So what we have seen is, first was crying. Crying was a vocal behavior that they indulge in. Along with crying, they also indulge in behaviors like different facial expressions. They like to they maintain eye contact with their caregivers for a long period. On the social smile, as we have known, develops, and eventually they start indicating their pleasures and emotions through their facial expressions. The next aspect is the gestures and the body movements. Now, as and when the child is gaining physical maturity, physical development is taking place, they use their bodies to communicate when upset or to protest. And they may indicate the desire for an activity to continue or to happen. As babies learn to control their bodies, the movements become more and more deliberate. The first step, when the child is still small, he is only indicating whatever his needs and wants are through crying. Then later on, they learn to communicate it via their facial expressions, and as and when they grow and they gain more control over their body, so they start indicating their preferences by their body movements.
So there we can say that there is progressive sequential changes
in their way of communication. This is the early social way of communicating that they use. Till the time they do not know that they have to manipulate the articulators and learn to speak. Now, children must have a reason to talk or they will not develop language. The use of sounds, facial expressions, body movements, and gestures lays the groundwork for talking. So, if there's no reason for the child to talk, they will not indulge in behaviors. As we were earlier also talking, कि एक opportunity होनी चाहिए. अगर that opportunity is not there, if the child is not pressed with the need to communicate, they don't have any reason to speak, so they will not indulge in behavior such as vocalization, crying, and eventually speech, because the whole opportunity, the whole situation, that is complex situation, is given to them of communicating. जब तक वो उनको force नहीं किया जाएगा to communicate, they will not come out with any speech, any output of that.
And that is supporting the factor that you have told earlier in the discussion, कि providing good opportunities to the child mainly क्या कहते हैं उसको, enhances the abilities to develop speech and language.
Reinforcement उसी से मिलता है, and this as you rightly put it, enhances their speech and language. Next is sound development. Now, talking requires a very precise coordination of the tongue, lips, teeth, and jaw, along with breathing and vibration of the vocal cords. So, we were earlier just discussing about the articulators. We know that speech requires the coordination of your articulators comprising of tongue, lips, teeth, jaw, and the vibration of the vocal cords. This coordination develops as babies develop physical control and are able to experiment with a variety of sounds. So sound development again comes when the child begins to manipulate his articulators in different manners, and then he comes to know that okay, this particular position will lead to this the production of this particular sound. And this again, the number of sounds that the child is able to speak develop as they gain more and more physical control over their articulators. क्योंकि जैसे जैसे बच्चे को physical development, motor development होता है, his articulators and other body parts are also functioning, and he gains control over their movements, he begins to experiment in terms of sounds that he is speaking and in terms of the movements that he can make.
And the child is learning as per the situation and the age.
Yes.
जैसे कि अगर हम variety of sounds की बात करें, तो sounds और किस style में, tone में हमें बात करनी कि if I'm talking to you will be different to if I'm talking to my age group people.
Yes, again, that is what you're talking about is pragmatics. That you have the sense that how to talk to your age group and how to talk to your superiors, and this all is occurring, all is occurring simultaneously. बच्चा अगर साउंड्स निकालना सीख रहा है, इट इज़ बिकॉज हिज फिजिकल कंट्रोल ओवर हिज आर्टिकुलेटर्स इज इंक्रीजिंग, सो ही इज़ मेकिंग डिफरेंट काइंड ऑफ माउथ मूवमेंट्स, और वो अलग अलग साउंड्स के साथ एक्सपेरिमेंट करता है. एंड इन वॉट सिचुएशन उसको क्या वर्ड बोलना है, कैसे बोलना है, सो दैट हिज नीड्स इज फुलफिल्ड, इज अगेन द pragmatics aspect of it. Now coming on to experimenting with sound, the first stage is the cooing, that is the use of varying vowel sounds in different कोइंग में सिर्फ वो वाल साउंड्स ही यूज़ करते हैं, आ ई ऊ ऐसी आवाज़ें ही निकालते हैं. देन दी साउंड्स आर then followed by other vowel sounds. Cooing expands when they try to imitate others, and as they develop more control of the articulators, they begin to produce consonant sounds. So the first step is cooing, जिसमें वो different vowels का use करते हैं to just communicate, no consonants are being used. धीरे धीरे when उनको अपनी articulators के ऊपर ज़्यादा control develop होता है, तो they begin to experiment and produce consonants. And after this happens, this stage of cooing continues till 6 months of age. Beyond 4 to 6 months, a stage called babbling starts, which is the use of consonant sounds in short and specific patterns such as ba ba ba. So first step ये ऐसी आवाज़ें निकालते हैं. Second step they start speaking like ba 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 ma ma ma. So वो फिजिकल कंट्रोल बढ़ रहा है आर्टिकुलेटर्स पे, सो दैट सम वेराइटी ऑफ साउंड्स आर ऑल्सो डेवलपिंग. सो दिस इज babbling and cooing are very essential to the speech and language development process. Now this was the early development. Now we see how further language development takes place. This is the typical receptive language development chart. In the first month, the child just responds to the voice of the parent or the caregiver. In the second month, their eyes follow the movement. Eyes follow the movement as in, if you have seen कि babies are kept in the cradle and generally parents will put a rattle or something and the child tries to follow the movement of the rattle along with the sound. By third month, they start cooing in response to pleasant voice. In the fourth month of their age, they turn their head in response to sounds. By 5 months, they start responding to their own name, and by 6 months, they appear to recognize words like daddy, bye bye, and mama. So by the 7th month, they show interest in the sounds of objects. But उनको अगर आप noise makers, okay. Then in the sounds of objects. Then by 8 months, they recognize the names of some common objects, and in 9 months, they follow simple directions. By 10th month, they understand no and stop. By 11 months, they appear to understand the simple questions. By 12 months, they recognize the names of objects, people, pets, and actions and verbs. So to summarize the development of the receptive language within the first year of a child's birth, first thing is they just start cooing. And धीरे धीरे by 4 to 6 months they start combining the consonant and vowel sounds. By 5 months they are able to respond to their own name, and by 7 to 8 months they start recognizing some familiar words such as bye bye, mama, dada, and it is by 12 months of age that they start recognizing the names of very familiar family members or objects that are used daily in their routines.
मैम जैसे कि आपने रिसेप्टिव लैंग्वेज के जो टिपिकल कंपोनेंट्स बताए कि एक प्रॉपर सीक्वेंस में कैसे डेवलपमेंट होता है आफ्टर मंथ बाय मंथ इन अ चाइल्ड, लेकिन इसके बारे में हम पता तभी कर सकते हैं कि जब पेरेंट्स को इसके बारे में, इन माइलस्टोन्स के बारे में अवेयरनेस हो कि जो नॉर्मल माइलस्टोन्स होते हैं कि बच्चे को 1 मंथ में इतना डेवलपमेंट होना चाहिए, 2 मंथ्स में इतना डेवलपमेंट, एंड इफ द पेरेंट्स आर नॉट अवेयर लाइक द different populations in the different areas, so how can they get to know about that?
See, that is why we emphasize on creating awareness first amongst the professionals, and then it is the duty of the professionals to pass this information to the parent, because this information of cooing, although this everything is available in the books and as well as on the net, but when a parent comes to you with a complaint, so you should know, first of all we should know कि किस age में बच्चे को क्या करना है. अगर child is doing something that is age appropriate, then the parent का concern is, we can tell the parents that okay, there is nothing to be worried about, he is following the pattern. Like I'll be telling you, बहुत often we see articulation का concerns, parents come with प्रॉब्लम्स लाइक कि बच्चा ये वाला साउंड सही नहीं बोलता है, जबकि वो एज होती ही नहीं है बच्चे की वो साउंड सीखने की. तो इसलिए ये नॉर्मल माइलस्टोन्स हमको पता होना चाहिए, सो दैट इफ द पेरेंट कम्स टू यू and you are not able to explain because you are not yourself aware of what are the normal way of developing, तो आप कैसे उनका क्वेरी सॉल्व करेंगे.
और जैसे आपने बताया कि कूइंग का अप टू 6 मंथ्स होता है बच्चे में, अगर मान लीजिए बच्चा 6 मंथ्स के अलावा 7 या 8 मंथ्स तक उसको फॉलो करता है, तो इसको क्या हम कंसीडर करेंगे कि इट्स नॉट अ पार्ट ऑफ नॉर्मल स्पीच एंड लैंग्वेज डेवलपमेंट?
See, why have I emphasized on the first month also is, अगर first year of language development is, if the child is not following the patterns as I had mentioned, then this can raise a query in not only you कि हो, and as well the parent may not be able to realize most of the time within 1 year parents को नहीं पता चलता कि, क्योंकि बच्चे कुछ ना कुछ आवाज़ें निकाल रहे होते हैं, but if they are not following this particular pattern and they do not start babbling, they don't go beyond cooing का age, then as a professional you know कि there is some problem and he requires intervention or further diagnosis. Most of the time it is the hearing impaired children who are missed, because they continue to make some sounds and the parents are not able to make out because they are not giving obvious responses. तो ये milestones में वो जब receptive language will always be possible when you are hearing something. Receptive means understanding. Understanding will come through hearing. So if the child is hearing properly, then all these milestones should occur in the order that I have mentioned. If somewhere there's an amiss, then it requires some attention. अटेंशन मतलब आप प्लीज़ चेक करिए कि क्या रीज़न हो सकता है इन टर्म्स ऑफ हियरिंग कैपेसिटीज़, इन टर्म्स ऑफ कॉग्निटिव कैपेसिटीज़, एंड इफ़ द चाइल्ड इज़ कॉट एट द राइट एज, early intervention is done, then the rehabilitation also does not extend for long and the child can be made independent earlier than what we previously were doing. So it is important that for early identification, I've mentioned the milestones in the first 1 month and 1 year of age. It is very important. क्योंकि this 1 year में if you catch a child who is having any sort of problem, then they can be rehabilitated and the critical period of language acquisition can be taken care of.
मैम जैसे ये आपने एक चार्ट बताया जिसमें हमने देखा कि अप टू 12 मंथ्स लाइक 1 ईयर तक हम कैसे माइलस्टोन्स का हमें पता लग सकता है कि दिस इज द प्रॉपर डेवलपमेंट चार्ट of receptive language mainly. So we will be discussing more about these facts after this short break.
हम होंगे कामयाब, हम होंगे कामयाब, हम होंगे कामयाब एक दिन. ओ मन में है विश्वास, पूरा है विश्वास, हम होंगे कामयाब एक दिन. We shall overcome, we shall overcome, we shall overcome someday. Oh, deep in my heart, I do believe that we shall overcome someday. We shall overcome someday. We shall overcome someday.
कोई मुश्किल हो, दूर मंजिल हो, never stops us from dreaming. हारता है वो, हार माने जो, we are what we believe in. हम धरती को अंबर से
This is Aparna. She loves chess and Shah Rukh Khan. Her best friend is Swati. She also has visual impairment. This is Neeraj. He plays many instruments. He loves Mohammad Rafi and cricket. He also uses crutches for mobility.
चंदा है तू मेरा सूरज है तू
This is Raj Bala.
मेरी आँखों का तारा है तू जीती हूँ मैं बस तुझे देख कर
With her husband and daughter. She loves cooking and watching TV.
सूरज है तू आ मेरी आँखों का तारा है तू
She also has cerebral palsy. Look beyond the disability. Look at the person.
वेलकम बैक टू आवर डिस्कशन। अभी तक हमने ब्रेक में जाने से पहले डिफरेंट एस्पेक्ट्स डिस्कस करे फॉर डेवलपिंग नॉर्मल स्पीच एंड लैंग्वेज, जिसमें हमने कॉग्निटिव स्किल्स देखे, लिसनिंग स्किल्स देखे। इस और स्किल्स के बारे में जानकारी के लिए हम अपने एक्सपर्ट से जानते हैं कि इसमें कैसे कैसे एक प्रॉपर सीक्वेंस में हमारा डेवलपमेंट हो सकता है एक नॉर्मल स्पीच एंड लैंग्वेज का बच्चे में।
First of all, in continuation with the development of receptive language, we first covered what all happens in the first year of a child's life. Now we will see how further receptive language development takes place. In 13 to 18 months, the child begins to understand some new words each week, identifies pictures in a book, identifies few body parts, and he begins to identify some common household objects. By 19 to 24 months, that is approximately 2 years, he recognizes many objects and pictures when named. He understands possession, that is, where is mama's shoe, and follows many simple direction. So we see that by 1.5 years of age, the child begins to understand some new words and he begins to speak at least छोटे two word type के phrases में they begin to talk. Then by 2 years of age, they actually start combining words and they make use of longer utterances, and they start recognizing some more of body parts. They start knowing that identify common objects, and they begin to refer to their family members, and their vocabulary in terms of the number of words that they can understand also increases. Now let us see what happens beyond 2 years. By 25 to 30 months, the child understands the use of objects, understands prepositions in, on, off, on, like these, and they understand simple questions, understand pronouns. So in 31 to 36 months, that is by 3 years of age, they'll begin to listen to simple stories, follow a 2-part command, and understand taking turns. So we see that beyond 2 years of age, around 2.5 months, what happens is development of prepositions, pronouns takes place. The child by 3 years of age, the child begins to tell you a short story in obviously fragmented version of it. थोड़ा recount करके they begin to their verbal output increases. They begin to follow 2-step commands, and they're able to understand that in a conversation they need to take turns, and while playing also they understand that okay, this has first is one person's turn, then turn taking develops further in the children. Now let's see what happens in terms of the expressive language development. During the first month, the child begins to make use of vowel-like sounds and crying emerge. By 2 months, the baby is able to produce different kinds of cries. And by 3 months, the baby begins using sounds like p, b, which are made with the lips and are easy to see and imitate. So first month the child just cries. Second month he begins to make use of differential cries. And the third month they begin to use sounds such as जिन्हें labials भी बोलते हैं, nasals बोलते हैं, जिनके production में the lips are coming closer together. By 6 months the child begins to produce simple syllables such as ma and pa. Vocal play is a very important foundation for spoken language during this period. By 7 months, he begins to put together two syllables while babbling, and some sounds begin to sound almost like the real words. Vocal play is more frequent. So by 6 months, we see that the child begins to use syllables, and by 7 months, they begin to combine these syllables into two parts, as in reduplicated syllables बोलते हैं, babbling शुरू कर देते हैं. And by 7 months, they try to imitate adult-like word orders. By 9 months, the child may sing along with music and has probably learned to play activities like peekaboo or patty cake. He can now babble a number of different syllables and learns to produce new sounds. He asks for toys and food by pointing and making sounds and shakes head for no. So by 9 months of age, the child begins to indicate whatever he wants or toys or food preferences by actually making some sounds and indicates no by shaking head. By 10 to 12 months, the child tries to imitate new words and usually says first word. The first meaningful word is basically achieved by 1 year of age. More sentence-like sounds are present. He may talk to family members without using true words, जिसको हम jargon speech भी बोलते हैं, that they follow the pattern of adult speech, but actually their words are not intelligible, clarity नहीं होती है. They make some musical sounds and may sing along if a rhyme is spoken to them, and may wave bye-bye when prompted. By 1 year, a baby who is developing language normally will use 1 to 3 spoken words. However, these words may have uncommon and unexpected meanings. Like the baby may use bird not just for birds but also kites and even airplanes. So this is basically referred to as overextensions, कि वो एक particular चीज़ के साथ कुछ features associate कर देते हैं, and that particular word is given to all the other things that are exhibiting similar features. This is overextension, which is found in 1-year-old children. So begin to make use of 1 to 3 word का phrase use करना वो शुरू करते हैं. By 18 months, the toddler repeats some overheard words and usually tries to communicate using real words. They may begin getting ready to put phrases together by linking single word with a long pause in between. So by 18 months, that is 1.5 years, they try to repeat whatever they are hearing and try to imitate whatever real words they are hearing, and they try to produce simple phrases. By 21 months, the child uses simple 2-word phrases such as the example mentioned. Single words, pauses between words decrease. They begin to talk about objects, locations and actions in short phrases, and use speech to control adults' behavior, to request toys, to answer questions and reject some foods. So by 1.5 to 2 years of age, the child has begun to speak and he makes use of short phrases. He begins to indicate his preferences and his needs by verbalizing. And he is able to make use of more and more words. His expressive vocabulary near about reaches to 150 to 200, 300 words. They begin to link to noun. Preferably nouns is the class of words that develops maximally first in the children. After that, the helping sounds develop, helping verbs develop. and they begin to combine these nouns, two nouns at least, to indicate their needs and preferences.
और इस पूरे प्रोसेस को डेवलप होने के लिए बहुत ज़्यादा ज़रूरी है कि जो आपने प्री रिक्विजिट्स बताए वो फुलफिल होने चाहिए.
Exactly. Within the first 3 years of life, we know that cognitive development also is simultaneously taking place along with speech and language development. So within those 3 years, actually the first year of one's life only, these cognitive prerequisites should be present. So this will further lay the foundation of the what do I say, the milestones that I have actually mentioned to you. So these prerequisites, if are present in the child, then it will lead to the development of these milestones in this particular order. However, if there's any amiss in between, then this may delay the process of the language acquisition in a child. Now, by 2.5 years, the children use more short phrases than single words. They begin to put together 3 to 4 word phrases. They go through a picture book, repeat the names of animals or vehicles, and make appropriate noises. More turn taking is obvious during conversations. So by 2.5 years, we know that the child now speaks in 3 to 4 word phrases. वो animal names repeat करते हैं. They make what are sounds are associated with vehicles. They try to imitate that. Then they take do more of turn taking while they are talking. Now we see the speech, language, and listening milestones. Within birth to 3 months, the child reacts to sudden noises by crying or jerking the body. He reacts to familiar objects such as a bottle or familiar people such as parents. Differential cry of pain and hunger are also observed. Coos begins to form prolonged vowels and changes in intonation, watches objects intently. So in the first 3 months, as it is mentioned, the child should have these speech, language, and listening milestones. So this is like a summary of whatever we have been doing so far. Within the first 3 months, the child begins to respond to sudden noises by they will either cry or they will indulge in a behavior that is called the startle reflex. एकदम से जोर का आप आवाज देंगे and the child just jerks. So this is first indication that the child is also hearing. So that way it is in these stages.
These reflexive mechanisms shows that the development is going normally.
Yes, definitely. And then they react to familiar objects such as bottle or familiar people. They express their pleasure or displeasure upon watching familiar people. So this will also lead to the recognition of the familiar objects in their environment. Then they begin to indicate their needs and wants through the differential cry patterns. Within 3 to 6 months, they begin to babble using syllables with a consonant and a vowel and use intonation changes. So 3 to 6 months में वो babbling में indulge करते हैं, और babbling is in the form of varying different intonation patterns. They cry, they either make a loud and a longer cry for hunger, and if they are in pain, then they'll make louder and the short cry. So there are different cry patterns जिससे कि बच्चे का need is recognized.
So we can say that the child is expressing himself, जो बच्चा खुद को express कर रहा है since birth.
Exactly. The child begins to respond and express himself since birth only. वो ये है कि जैसे जैसे उसका motor development बढ़ता है, तो
age के साथ उसका progressive development होता है, but he is expressing since birth only.
Since birth, yes. The only difference is within first year of his life, he is a passive communicator. Most of it is like वो कुछ action करेगा या he is in distress. So the parent has to interpret what state the child is in, rather than the child himself indicating कि उसको क्या problem है. धीरे धीरे this role transition takes place. That is, the child becomes an active communicator. He begins to actively tell. वो खुद से बताना शुरू करते हैं कि what they want, what they don't want, either by gestures, either by speech, in response to like shaking of head or jerk reflex, or they would simply just simply walk away अगर उनको कोई preference नहीं है, कोई चीज़ नहीं चाहिए. And they turn head towards sound. They react to his or her name and use a louder voice for crying and babbling. So by 6 months of age, the child begins responding to his own name. And if the child has not started to do it, then you know that there is something to be suspicious of. And you can always like it can always tell you that the child may need an extra intervention or assessment needs to be done for the child if these milestones are not occurring in this order.
मतलब माइलस्टोन्स अगर प्रॉपर एज में डेवलप नहीं हो रहे हैं तो पेरेंट्स को एक इंडिकेशन मिल जाता है कि दैट दे हैव टू लुक फॉर दैट कि समथिंग इज
Missing
रॉन्ग
in
गोइंग
it, yes. And as a professional we should be very sensitive to these development milestones, क्योंकि अगर we know that okay the child follows these developmental progression milestones, then we will be in a better position to comment about the state of the child, and this will help us to also know कि कहाँ पे problem हो सकता है. It is not like we are just sitting and contemplating कि problem क्या है. It will also help us realize कि maybe there is some problem with the hearing, so we need to check for a hearing. Maybe there is a problem with the cognitive capacity of the child, could be retardation, could be autism. So this just alerts the professional as well as the parent if the child is not following them in a particular order. Now beyond 3 to 6 months, around 6 to 9 months, the child begins to comprehend simple words such as no and looks at family members when named. He babbles with a sing-song pattern at times, understands facial expressions and reacts to them, attempts gestures to correspond to pat a cake and bye-bye, shakes head to show no, uses more and more sounds when babbling such as syllables with da, ba, ka, pa, ma and va. So by 6 to 9 months they begin comprehending simple words, especially no और जब family members का नाम लिया जाता है they begin to babble in a sing song pattern, और facial expressions they are able to understand, like they can कि अभी मम्मा को गुस्सा आ रहा है या पापा को गुस्सा आ रहा है, so they can actually begin to indicate कि उनको with their facial expressions they can understand. The child begins to understand. So you would also have often observed कि if you show an angry face to the child, he suddenly starts crying because he is contemplating कि there is some difficulty, that there is some problem. Next we will see in 9 to 12 months what happens. The child enjoys imitating simple sounds. He begins to say mama, dada or another word sometimes, and begins to understand that words represent objects. He responds to music, gives or seeks a toy or common object when requested, imitates common animal sounds, gestures and whines to request something, looks directly at the source of the sound. So the child in this period, by 1 year of age, now has begun to do reduplicated babbling, that is he indulges in more and more vocal play and he begins to make use of more and more words and sounds. And actually by 1 year of age the first true meaningful words of the children appear. They know that they intend to, if they want to seek a toy or something, then they will give it, and they try to imitate the common animal sounds, and if something is not done according to their wish, then they can express their displeasure via gestures, and direct localization of the source of sound is also observed. Around 12 to 18 months, that is by 1.5 years, the child is able to understand around 75 words. So his receptive vocabulary comprises of 50 to 75 words, and he uses around 20 real words, even if the articulation is not clearly intelligible. That is, expressive vocabulary comprises of 20 words. And when simple questions are asked that where is mama, where is the daddy, so they will be able to point to the actual place where the object is located. They point to known objects when named. They point to few simple body parts, follow simple one-step commands, and use more words like all gone, lying down. So by 1.5 years of age, their receptive vocabulary becomes 50 to 75 words. Expressive vocabulary they are able to speak around 20 words, and they are able to indicate to a person when simple questions are asked, they are able to point. They are able to point to objects when they are named. Few body parts come, they start indicating. So by 1.5 years of age, the child should be doing all these things. And अगर बच्चा ये सारे माइलस्टोन्स नहीं कर रहा, it doesn't mean that the child definitely has a problem. सारे करना is not a requirement.
All other factors should be assessed, कि देखना चाहिए कि हो सकता है किसी और फैक्टर की वजह से बच्चा नहीं डेवलप कर पा रहा.
Yes, and हमें इतना क्रिटिकल भी नहीं होना चाहिए कि all of this should be there in one order, टिक टिक टिक. तो तभी बच्चा नॉर्मल है.
जी.
There may be some things which may be present in the child, there may be something which may not be present in the child, and language development is greatly influenced by the environment of the child.
जी.
तो उसका एनवायरनमेंट कैसा है, वो उसके साथ इंटरेक्शन कैसा हो रहा है, उसके ऊपर भी डिपेंड करता है उसकी वोकेबलरी.
लाइक जैसे एनवायरनमेंट का डिफरेंस हो गया, कुछ स्पेसिफिक एरियाज का भी होता है कि लैंग्वेज दूसरे एरिया में है और इफ दे आर शिफ्टिंग टू अनदर
Yes,
एरिया देन देयर इज
exactly.
अ लैंग्वेज डिस्क्रिपेंसी.
Exactly.
और फिर उसके बाद इफ द बोथ पेरेंट्स आर वर्किंग then also the problem is coming.
Yes, so environment really plays an important role. Agar if the child is not doing all these things and you assess the environmental factors, and then you will come to know where the problem is. Sometimes we just diagnose कि maybe बच्चा नहीं बोल रहा है तो ज़रूर उसका delayed speech and language है, कुछ mental retardation issues है,
जी.
without knowing about the environmental factors. Maybe the child is not getting enough amount of stimulation at home in
जी.
order to speak. Opportunities are not there. Nobody is talking to the child. Nobody is reinforcing his attempts. So the child is not. If the child is not getting input, how can we expect the
Because
child
the
to come up
child
with the
learns
output?
most of his activities through imitation only.
Yes, and he needs somebody to communicate with. If the child is not getting that other person to communicate with, then there is no reason for him to
जी.
speak at all. So इसलिए both the environmental factors as well as the physiological factors should be assessed by a professional if a parent comes to you with a complaint of delayed speech and language. Then comes from 18 months to 2 years. Now the receptive vocabulary comprises about 300 words, and expressive vocabulary comprises of 50 words, mostly nouns, and they begin to indicate a question, asking questions in a rising intonation pattern. They are able to follow two related commands, begin to use some verbs and adjectives, and they start to ask simple WH questions. And when his or her name is asked, they are able to tell it, and they speak with many pauses between words. So by 2 years of age, their receptive vocabulary should be comprising of 300 words, and their expressive vocabulary should have around 50 words. Now if the child again is not able to speak so many words, if other milestones he is achieved, like he's able to follow two commands, he's able to use verbs and adjectives, then also it is all right. So one should not be very critical also. You should be very much observable about other holistic factors of the child. If the child is doing other things appropriately and some few words or few words are not there, body parts are not there, even at 2 years of age, it does not mean it puts the child in the delayed speech and language category. Maybe the child is not exposed to that language. तो वो चीज़ों को सेंसिटाइज होके इन फैक्टर्स को critically analyze करना चाहिए. If we are not sensitive to all the factors and we just go by what is given in an order, we might misdiagnose a child who is having a normal path of speech and language
तो इट्स
development
नॉट
also.
स्ट्रिक्टली बेस्ड दैट कि जो सारे माइलस्टोन्स दिए हैं कि वन बाय वन वी शुड चेक एंड टिक कि दिस इज प्रेजेंट इन द चाइल्ड एंड दिस इज नॉट येट बीन डेवलप्ड.
एग्जैक्टली क्योंकि कई बार ऐसा होता है कि पेरेंट्स डोंट हैव द टाइम टू सिट एंड टीच फैमिली मेम्बर्स का नेम और फ्रूट्स एंड ऑब्जेक्ट्स का नेम, एंड द चाइल्ड इज not knowing, जबकि he has normal hearing, normal intellectual capacities. On the other hand, if you have a person who has got some amount of hearing impairment and the parents are over enthusiastic in teaching the child, he may have all these
एंड ऑल दीज फैक्टर्स जो भी आपने फैक्टर्स हमें बताए, ये इस चीज़ के लिए भी रिस्पॉन्सिबल हो सकते हैं कि जैसे कुछ पेरेंट्स कंप्लेन करते हैं कि और बच्चे तो बहुत बातें करते हैं एंड माई चाइल्ड इज नॉट टॉकिंग.
Yes, तो वही इसी कंप्लेन को लेके we cannot put the child in delayed speech and language category. We have to see the chart, we have to see the milestones which the child has achieved, but at the same time we have to assess the other factors also, comprising of how much stimulation he is getting at home. And if the child is not able to do this much and the other factors are intact, you know that you can tell the parent कि by 2 years of age he should be doing this. So at home, when you're counseling for speech and language stimulation at home, you are simply not going to say that go do stimulation, go speech and language stimulation with him, जाके बात करो. What you have to talk what क्या आप उसको, अभी जो बच्चा 2 साल का नहीं हुआ है, you cannot go and tell stories to him, you cannot ask questions based on a story, उसकी उतनी cognitive capacities नहीं है.
एज अप्रोप्रिएट सिचुएशन के अकॉर्डिंग और एनवायरनमेंट के अकॉर्डिंग स्टिमुलेशन हमें देना चाहिए.
यस, और उसका जो एज है उस पर उसको जो आना चाहिए उसके हिसाब से व्हाट जो भी मिसिंग है वो आप उसे बताएंगे ना. पेरेंट विल आप बोल देंगे इन अ ग्रॉस टर्म दैट गो एंड टॉक टू द चाइल्ड, पेरेंट विल नॉट नो, दे विल अननेसेसरली डू द जार्गन या कुछ भी बोलते रहेंगे जिसका कोई मीनिंग नहीं होगा.
जी.
You have to counsel about quality time that the parent needs to spend with the child, and along with that the milestone with the child has not achieved, वो आपको तभी बता पाएंगे when you are actually aware of what milestones should come by 2 years of age. So you know that 2 years में बच्चे को ये इतना कर लेना चाहिए, इतने वर्ड्स आने चाहिए, उतना वो आना चाहिए, वो एडजेक्टिव्स आने चाहिए, फ्रूट्स आना चाहिए, एनिमल्स आना चाहिए, ये कैटेगरीज आ जानी चाहिए, तभी आप काउंसिल करेंगे. तो पेरेंट विल गो एंड वर्क ऑन दो स्पेसिफिक साउंड्स rather than working on some other things. They may be working on something like adjectives or
And
plurals
it
or
may be
tenses.
irrelevant according to the age.
Yes. So that to avoid that, we should be sensitive to the normal development and we should know what to tell to the parent when they are counseling. ये भी पता होना चाहिए कि कब हमें नॉर्मल बोलना है उसे और कब हमें उसे डायग्नोज करना है विद delayed speech and language. Now, by 2 to 3 years of age, the child understands about 900 words. He uses about 500 words, so that means that receptive vocabulary comprises of around 900 to 1000. He is able to speak around 500 words. He engages in eye contact during conversation. By 3 years of age, gender concept starts developing, that he understands the difference between a boy and a girl. And he begins to answer some simple WH questions like who, where, what. He understands and uses simple prepositions, begins to ask yes no questions, and he should begin to use past tense, simple past tense, and pronounce the following sounds as mentioned: m, n, p, f, b, d. All these sounds should be there in a 3-year-old child. Now again, as we had seen that 3 साल के बच्चे should be able to understand around, उनका receptive vocabulary should be around 900 to 1000 words and their expressive should be around 500 words, और थोड़ा सा उनका और turn taking बढ़ता है, attention बढ़ता है, and they start answering simple questions. They, by gender concept, simple plural and past tense concept begin by 3 years of age.
तो हम कह सकते हैं कि एक एज के साथ जैसे जैसे प्रोग्रेशन होती जाती है और सारे कॉन्सेप्ट्स भी
Yes.
इंट्रोड्यूस हमें कराने चाहिए बच्चे
Exactly.
को, और हमें ये कहना चाहिए कि जैसे आपने बताया 3 इयर्स तक इतने कॉन्सेप्ट्स बच्चे को आना ज़रूरी है. तभी हम कह सकते हैं कि एक नॉर्मल स्पीच एंड लैंग्वेज डेवलपमेंट बच्चे में हो रहा है. जैसे कि हमारे एक्सपर्ट बता रहे हैं विद एग्जांपल्स के एक एज के अकॉर्डिंग हमारा रिसेप्शन और एक्सप्रेशन लैंग्वेज किस तरीके का होना चाहिए. बाकी की डिस्कशन हम एक छोटे से ब्रेक के बाद करेंगे.
ऑटिज्म एक व्यापक विकासात्मक विकलांगता है जिसके लक्षण जीवन के प्रथम 3 वर्ष में ही दिखाई पड़ते हैं, जैसे असंगत खेल, असमान स्थूल एवं सूक्ष्म गामक क्रियाएं, शाब्दिक संकेतों पर अभिव्यक्ति न देना,
Where is the cup? देखो, open your eyes, open करो, open करके, open.
नियमित कार्यक्रम परिवर्तन का विरोध करना एवं अवलोकनीय शारीरिक उच्च स्तरीय या निम्न स्तरीय क्रियाकलाप. UNCRPD 2007 सेक्शन 1 ऑफ आर्टिकल 4 निशक्तता के क्षेत्र में कार्यरत प्रोफेशनल के प्रशिक्षण पर महत्व देता है. ऑटिज्म के क्षेत्र में सरकारी एवं गैर सरकारी संस्थाएं कार्यरत हैं जो भारतीय पुनर्वास परिषद द्वारा पंजीकृत हैं. सोसाइटी फॉर एडवांस स्टडी इन रिहैबिलिटेशन एक ऐसी ही गैर सरकारी संस्था है. कनिष्क 13 साल का एक ऑटिस्टिक बच्चा है जो इसी संस्था से प्रशिक्षण प्राप्त कर रहा है. असंगत क्रियाएं, कार्यकलापों में निरस्ता, असमान स्थूल एवं सूक्ष्म गामक क्रियाएं जैसे बॉडी रॉकिंग और फिंगर रिगलिंग उसमें देखी जा सकती है। उसे मैचिंग और पेस्टिंग, पॉइंटिंग जैसी क्रियाएं सिखाई जाती हैं।
वेरी गुड। ग्लास, वेयर इज द ग्लास? ग्लास, वेरी। कप को टच करो जल्दी से, कप को। वेयर इज द कप? वेरी गुड। कप में क्या करता है कनिष्क? टी पीता है। चलो ग्लास, वेयर इज द ग्लास? वेरी गुड। चलो बाउल की तरह, बाउल बाउल जल्दी से टच करो बाउल को। वेरी गुड। बाउल में क्या करता है कनिष्क?
तथा साथ ही साथ रोजमर्रा की आवश्यकताएं जैसे खाना, पीना, कपड़े पहनना, और व्यायाम संबंधी प्रशिक्षण दिया जाता है। ऑटिस्टिक बच्चों को भिन्न भिन्न प्रकार की कार्यविधियां उनके स्तर के अनुसार सिखाई जाती हैं। जैसे कुछ बच्चों के लिए कलरिंग विद इन वन एरिया, मैचिंग एंड आइडेंटिफिकेशन, फाइन मोटर स्किल्स, आई हैंड कोऑर्डिनेशन, concept of vegetables, fruits, body parts, कलर्स पर जोर दिया जाता है तथा कुछ को प्रश्न पढ़ के उत्तर देने में और रोजमर्रा की आवश्यकताओं को पूरा करने में सक्षम बनाया जाता है। इसके अलावा राइम्स, डांसिंग, सिंगिंग द्वारा लेजर एंड रिक्रिएशनल एक्टिविटीज में भाग लेने के लिए प्रोत्साहित किया जाता है। इन सभी कार्यकलापों एवं प्रशिक्षण का एकमात्र उद्देश्य उन्हें स्वनिर्भर बनाना है, ताकि ये डगमगाते पांव सक्षम बन जीवन के एक एक पायदान पर दृढ़ता से आगे बढ़ें और अपनी मंजिल को पा लें। एक तारा टिमटिमाता, उसने आकाश को छू लिया। एक लौ जली कहीं, उसने अंधकार को मिटा दिया।
हम होंगे कामयाब, हम होंगे कामयाब, हम होंगे कामयाब एक दिन। ओ मन में है विश्वास, पूरा है विश्वास, हम होंगे कामयाब एक दिन। We shall overcome, we shall overcome, we shall overcome someday. Oh, deep in my heart, I do believe that we shall overcome someday. We shall overcome someday. We shall overcome someday.
वेलकम बैक टू आवर डिस्कशन। हम डिस्कस कर रहे हैं डिफरेंट माइलस्टोन्स एट द डिफरेंट एज, सो वी विल कंटिन्यू दैट डिस्कशन विद द एक्सपर्ट।
So far we were looking at the speech and language development milestones, जो कि आपके मतलब बच्चों में किस एज में क्या क्या होना चाहिए. So we covered till 3 years of age. Now we will see how the sounds develop, the speech sound, which is a major concern across many people. By 2 to 4 years of age, the child should develop the following phonemes like p, m, h, n, v, b, k, g, d, t. तो अगर ये वाले स्पीच साउंड्स आर प्रेजेंट इन चाइल्ड टिल 4 years of age, देन इट्स इज फाइन. अब बियॉन्ड 4 years to 5 years की एज ग्रुप में फ, य, ग, ल ऐसे साउंड्स डेवलप करते हैं. एंड 6 to 8 ईयर्स में र, च, स, श, ज, य, फ, व ये वाले साउंड्स डेवलप करते हैं. सो दिस इज द एज एट विच दीज पर्टिकुलर स्पीच साउंड्स आर मास्टर्ड. If the child is not able to speak like p, b beyond 4 years of age, then we know that there is a need for intervention, because the age for acquisition of these sounds is still 4 years of age. We can only give the time frame of 4 years. If beyond 4 years, if the child has problems producing these sounds, then definitely the child requires some intervention. तो ये age appropriate हमें पता होना चाहिए, क्योंकि articulation is a major concern across many people these days. If the child is not able to speak one word and properly articulate properly, the parents immediately get alarmed. So we should know by what age what sounds come. It often happens that parents will come even at 5 years of age or 4 years of age with a complaint that the child is not able to speak sounds such as r, sh. They still have time for speaking these sounds. At least by 5 years or 6 years they can still learn to speak these sounds. So we need to tell the parent that your child is not having any disorder. It is just that he is still in the process of developing the sound. He has still not surpassed that age at which the sound should occur. तो ये पॉइंट्स कॉन्टेम्पलेट करना बहुत ज़रूरी है, इनको सोचना बहुत ज़रूरी है. एंड इट इज़ नॉट लाइक दिस ऑर्डर इज़ गिवन और ये इसी ऑर्डर में होता है. कई बार चिल्ड्रन बिगिन टू स्पीक स, श, ज इवन वेल बिफोर 5 years of age, whereas 6 years to 8 years is the time frame that has been mentioned for their development. So it varies from individual to individual. ऐसा नहीं है कि हर बच्चा इस एज में ही एक्वायर करता है. कोई जल्दी एक्वायर करता है, कोई देर से एक्वायर करता है. बट वी शुड नो द फाइनल टाइम विंडो जिसको आप अलाउ कर सकते हो कि इसके बियॉन्ड भी अगर बच्चे को वो साउंड नहीं आ रहा है तो ये प्रॉब्लम है.
मतलब पेरेंट्स को एक एज अप्रॉक्सीमेशन होना चाहिए कि यहाँ तक जैसे अगर हम गए 6 to 8 years तक पूरा मास्टर हो जाना चाहिए कि इतने साउंड्स आ जाने चाहिए. मतलब
पेरेंट्स से ज़्यादा एज अ प्रोफेशनल हमें बताना चाहिए, बिकॉज in a regular day-to-day experience or practice, you will see many of the parents, their child is just 4 years of age, they will come with the concern कि ये ल नहीं बोलता है, र नहीं बोलता है, and we only counsel them that there is still time for them to develop the sound.
जी.
So you need not get worked up about it. You need not feel कि वो sound नहीं बोल पा रहा है तो उसको अभी help चाहिए, वो articulation problem है. ऐसा नहीं होता है. The only thing is we can just give them some indirect intervention strategy so that they can go and work with the child at the home. और वो फिर their tension and their worries are also, their stress levels are also put down, because unnecessarily अगर बच्चे का एज ही नहीं है वो साउंड डेवलप करने का and you're teaching that sound, then it can have negative effects on the child as well. Now we know that during the normal speech sound development we do make some kind of errors, and normal children also do that. Like they will exhibit processes like substitutions, and they have what we call a pattern of production of sounds of adult word forms जो कि errored होती हैं. That is known as phonological processes. So all children during the normal process of development indulge in phonological processes. Now phonological processes is the simplified version of the adult word forms that the child uses. Like if for example if the child wants to speak red and he speaks lead or ved, तो वो ऐसा है कि he is simplifying the sound. जैसे ट्रेन नहीं बोल, ब्रेड को बेड बोल दिया, तो ही सिंप्लीफाइंग दैट एडल्ट प्रोडक्शन. सो दिस इज फोनोलॉजिकल प्रोसेस, एंड अगेन this is exhibited in all the children across all the age groups in normal period of language development. और अगर ये errors are occurring well beyond 8 years of age also, then definitely the child needs a very direct intervention. Obviously you have to see which age which sound the child is making errors on and which age the sound should come. If that age is surpassed, then yes, direct intervention is required. Then intelligibility, in terms of how intelligible the speech of the child is. Now by 2 years of age they have 25% of intelligibility, that is they are intelligible to familiar adults. Only those people who are there in the environment can understand what the child is speaking. By 3 years the intelligibility improves as the physical control over the articulators increase and the child learns more and more complex articulatory movements and complex sounds. So their speech becomes around 80% intelligible by not only familiar adults but others who are working with the children along with their teachers and other caregivers. By 4 years of age, the child intelligibility is absolutely normal. That is, the child's speech is intelligible to an unfamiliar speaker as well who does not know how the child speaks. So by 4 years of age, if the child is having this much of intelligibility that a person is any unfamiliar person is also able to understand his speech, then there is no issue to be concerned about. Now, we had seen the receptive and the expressive language age in terms of the semantics and the syntactic aspects. कि मतलब semantics यानी वो कितने words और use कर सकता है. Syntax मतलब gender concept, plural concept, and what is the word order that they are following.
Different concepts.
Yes. Now we will look into the pragmatic aspects of language. Now, by 12 months of age, the child just initiates interaction. Now, initiation of interaction could be either just smiling to the caregiver or a familiar speaker, or either just looking at the parent, maintaining some eye contact, crying.
So it can be verbal or non-verbal.
Yes. In 1 year, the child just begins to initiate any intent to communicate. वो बस एक अपना communicate करने के लिए he will just initiate the process. वो this can be through gestures and this can be through cooing or babbling also. Now, between 1 to 2 years, the child is yet not aware of the listener's needs. Parents and conversation partners scaffold interactions. मतलब by 2 years of age, the child still is not sensitive to the other person's need. He will just be thinking from his own perspective. He will not think कि अगर मैं ऐसा करूँगा तो that the other person may be benefited or the other person may like it or may not like it. He will not do anything from others' perspective. He will think from his own. तो इसको हम egocentric stage बोलते हैं. That the child just thinks about himself, what he wants to do. और जो conversations होती हैं उसमें the parents and the conversation partners are scaffolding the interaction. That is, they are the persons who are dominating the interactions. They are the persons who are offering more and more word build up in order to expand the interaction. By 3 years of age, now the child begins to initiate dialogue. That is, he initiates any topic or any topic of conversation between the parent and himself and holds the listener's attention. Conversational taking is developing and is better able to answer questions. So by 3 years of age, you would see, अगर आप 3 साल के बच्चे से पूछेंगे आपका नाम क्या है, they will try to answer your question. Then they will also indulge in turn taking. You ask them something, then they will ask you something. So 3 साल के बच्चे इतना करना शुरू कर देते हैं. And they begin to initiate a topic. They begin to ask things. The questioning ability rarely rises around 3 years of age. They begin to ask you, what is that, what is this, who is going, what. So वो ability से again their concepts are building up, and in the process they are learning. They are now accepting the importance of other person in the communication. Before 2 years of age, the communication was oriented according to them. वो जो उन्हें चाहिए, जो उन्हें करना, and they were just not incorporating or were being sensitive to other persons, other communicators' need. Beyond 2 years of age, by 3 years of age, the child begins acknowledging the importance of the other conversational partner, as well as they indulge in turn taking also. Between 3 to 5 years of age, the children begin to understand that they need to be polite and how to address people who are superior to them or who are younger to them. They are able to respond to conversational breakdown. Now, what do we mean by conversational breakdown? Is बात करते करते just suddenly the topic is dropped off. So they are able to continue. They are able to come back to the topic and again start talking on that. So वो 3 से 5 साल की एज में ही आता है कि बच्चा एक टॉपिक के ऊपर बात कर सकता है, and in between if the conversation is just interrupt or something, he can still resume the conversation.
And this should be reinforced by the parents itself.
Yes, the parents are very important in every aspect, in every stage of development of the children. So ये सब चीज़ें, why we are sensitizing is that pragmatics is one aspect which is often overlooked. अगर बच्चा ये वर्ड नहीं बोल पा रहा है या ये सेंटेंस नहीं समझ पा रहा है तो प्रॉब्लम है, लेकिन ये भी एक सेंसिटिव इश्यूज होते हैं. अगर बच्चा ये सब नहीं कर पा रहा है, then these are the signs that the child may have some issues with the pragmatic aspects of language. And these days we are, as the current terminology is improving and the diagnosis is becoming more and more precise. So we are having children who are having pragmatic disorders also. उनको specifically किस situation में किससे बात करना है, कैसे बात करना है, क्या address करना है, कैसे politely बात करना है, they don't have those concepts.
अगर जैसे बच्चे को pragmatic disorders है, like the child is not aware कि कैसे उसको बात करनी चाहिए, तो हम उसको कैसे convince करा सकते हैं, how we can counsel the child कि उसमें ये फीलिंग ना आए, इन्फीरियोरिटी ना आए, नेगेटिव फीलिंग्स ना आए, और उसका कॉन्फिडेंस बना रहे, तो हम उसको बूस्ट अप कर सकें और उसको एक राइट वे दिखा सकें.
See, all of this is it's a big काइंड ऑफ एक थेरेपी अलग ही होती है जो इनको प्रैग्मेटिक डिसऑर्डर, जैसे कि आपने टर्म इंट्रोड्यूस किया है. दिस प्रैग्मेटिक डिसऑर्डर चिल्ड्रन, दे हैव एडिक्वेट स्पीच एंड लैंग्वेज, सो यू नीड नॉट टीच देम न्यू कॉन्सेप्ट्स एंड न्यू वर्ड्स, बट देयर इज़ अनदर वे टू टीच देम. उनको कैसे बात करना है, यू कैनॉट गिव डायरेक्ट और इनडायरेक्ट. डायरेक्ट इंटरवेंशन आप नहीं दे सकते उनको, एज यू पुट इट. इनडायरेक्ट इंटरवेंशन देना होता है, फॉर्मल सेटिंग्स ऑर्गेनाइज करना होता है कि
वी हैव टू मोल्ड देम इनटू डिफरेंट सिचुएशंस.
We have to expose them to different situations, and they have to learn to see, and through imitation and modeling we have to teach them that how they need to behave in that particular situation. अगर आप किसी नॉर्मल बच्चे को भी देखो तो वो अपने घर में जैसे शरारतें करता है, एंड पेरेंट इनवेरिएबली उनको किसी के घर लेके जाते हैं तो वो खुद बोल देते हैं कि चुपचाप बैठना, शोर नहीं मचाना. सम चिल्ड्रन आर एबल टू ग्रास्प इट, बट समहाउ देयर आर चिल्ड्रन जिनको शायद वो कॉन्सेप्ट नहीं समझ में आता है. तो उनको ऐसे सिचुएशंस के ज़्यादा एक्सपोज करो, उनको ज़्यादा सेंसिटाइज करवाना. दिस इज़ अ होल डिफरेंट वे ऑफ डीलिंग विद चिल्ड्रन हु हैव प्रैग्मेटिक डिसऑर्डर, बिकॉज यू आर नॉट लुकिंग एट एन एक्सप्रेसिव डिले, यू आर नॉट लुकिंग एट अ रिसेप्टिव डिले. You're looking at a person who is having difficulty in effectively communicating with the environment. जैसे कि autistics होते हैं, they have difficulty in social interaction. They do not know कि उनको कैसे अपने environment से interact करना. तो similarly these pragmatic disorder children are at the, जिनको हम high functioning autistic भी बोल सकते हैं, they're at the higher end of the disorder. That is, they have extremely good speech and language skills, but what to speak and how to speak in a particular situation is what is lacking in them. So you can only do this through role model or through imitation. You can try to help them by exposing them to these situations only. इनके लिए you have to be very careful while you're dealing with therapy, because otherwise the child person may not respond well to your therapy if you're just teaching some concepts or teaching some words which are absolutely irrelevant in such cases. And these milestones should be knowing, so that you know कि by 3 years of the child, अगर आप किसी बच्चे को देख रहे हो with the delay in his expressive and language skills, तो as I said, this is a whole holistic process. It involves receptive, expressive language, semantics, syntax and pragmatics. If you see the development of the child, normal child develops from all the perspectives. ऐसा नहीं है कि पहले आपका semantics आ जाएगा, फिर word order सीख लेंगे, उसके बाद social use of language आएगा. All this simultaneously comes to the child. So when you're dealing with the child who has have a delay in a speech and language disorder, then you know that you have to target all the 3 areas where the child is lacking, and you should know for that matter कि किस area में क्या उसका किस milestone को उसको achieve करना है. Now these are certain ways in which you can counsel the families in developing the listening skills of the child. First of all, the most important is that the comfortable family environment should be there. The child should be given adequate amount of attention and care. Then parent should repeat and expand on what the young child has to speak. That is, we term this as expansion. जो बच्चा word बोलता है, it is parent को you can counsel to build up on that particular word and give it back to the child. Like if the child is playing with the car and he says car, then the parent can modify the utterance and say red car, and the red car goes fast. So you're building up on the utterance, and the child is learning new words also, and this is an indirect way of intervention. You're not telling the child speak red car goes fast. You're just building up on the utterance, and the child will catch it and he will try to imitate it in a different environment. Then a parent should also be a good role model for listening. Much as the parent are involved in the act of speaking, in teaching the child how to speak, they should also be involved in the act of listening. They should sit and listen to what their child has to speak. Often we have seen that that these language disorders stem from the fact that the parents are not good listeners. disorders like fluency disorders, बच्चे अटकते हैं because in order to speak fast, the parents don't have the time to sit and listen to what the child has to speak. They intend to speak fast, and then speaking fast, their articulation may get affected, their fluency may get affected, and these are the root causes for the development of such speech problems.
So ये different जैसे reasons आपने बताया fluency में problem होता है, तो there must be different therapeutic intervention for different problems.
Yes, the therapeutic intervention will obviously be different for different type of disorders. What I want to highlight here is that along पेरेंट का रोल सिर्फ बच्चे को बोलना सिखाना नहीं है, जो बच्चा बोल रहा है वो सुनना भी है. अगर वो सुनेंगे कि बच्चा क्या कह रहा है, then the child will be at peace that my words, my speech is being heard, it is being paid attention to. This will obviously reinforce his attempts to communicate. One. Second thing is, the child will know that my parents are having time to listen to me, so I need not hurry up and say everything in one go. तो वो जल्दी जल्दी बोलते हैं तो क्लैरिटी कॉम्प्रोमाइज़ हो जाती है, फ्लुएंसी कॉम्प्रोमाइज़ हो जाती है. सो उनको अवॉइड करने के लिए द पेरेंट्स शुड नॉट ओनली बी गुड रोल मॉडल फॉर स्पीकिंग, बट दे शुड ऑल्सो बी गुड लिसनर्स ऑल्सो. Then provide sounds to the child that they find interesting, making use of music and voices. ये सब आप speech language stimulation के बारे में जब आप काउंसिल करते हैं पेरेंट को, यू कैन टेल ऑल दीज पॉइंट्स. रीडिंग एंड टेलिंग स्टोरीज विच आर एसेंशियल टू स्पीच लैंग्वेज एंड लिसनिंग डेवलपमेंट. Rhymes, singing songs, describing what you are hearing, seeing or touching is also a way to which you can develop the listening skills of the child as well as language skills. Now some of the activities that when a professional can deal with the person, आपके पास toys हैं, you have so many activities to deal and work with the child and you can teach, अच्छा ये activity करा देंगे. But what about the parents? The parents cannot procure so much of therapy material as you have. So what the best way is to counsel the parents how they can incorporate the language teaching activities in their daily routine. Like in the mealtime concepts है, बच्चे खाना खा रहे हैं तो you can teach so many nouns to them. फूड, टाइप्स ऑफ फूड, ये कुक्ड वेजिटेबल्स हैं, ये वेजिटेबल्स होता है, ये फ्रूट्स का डिफ्रेंसिएशन, कुक्ड, अनकुक्ड, स्वीट, सॉल्टी. देन व्हाट आर द यूटेंसिल्स दैट आर बीइंग यूज्ड, then what are the actions that are being involved, like eating, drinking, tasting, chewing. ये सब verbs हैं. These verbs, this is the way you can teach verbs to the children. Then coming on to opposites, hot, cold, sweet, sour, more, less, and adjectives, colors and different shapes of foods. ये soft है, ये sweet है, ये crunchy है, ये baked है. तो ये सारे concepts you are teaching and in a natural environment. बच्चा खाना खा रहा है और उसमें ही आप नाउन्स भी टारगेट कर रहे हो, वर्ब्स भी टारगेट कर रहे हो, यू आर टारगेटिंग ऑपोजिट्स ऑल्सो, यू आर टारगेटिंग एडजेक्टिव्स ऑल्सो. सो पेरेंट नीड नॉट थिंक कि अरे मेरे को एडजेक्टिव सिखाना है तो कब सिखाऊं, मुझे
one
नाउन सिखाना
activity
है.
should include all the concepts.
Yes, one activity and many goals. So that is, and the parent does not have the time कि वो 1 घंटा nouns सिखाएंगे, 1 घंटा verbs सिखाएंगे. So it is the duty of the profession to cleverly counsel the parent कि वो एक activity से कैसे उनको बच्चे को बहुत सारी चीज़ें सिखा सकते हैं.
और वो एक्टिविटी ऐसे नहीं चाहिए कि यूजुअल रूटीन में चलती है.
हाँ, काफ़ी चीज़ें विद इन रूटीन यू कैन टीच द चाइल्ड. सो दैट इज़ व्हाट शुड बी द टारगेट ऑफ द प्रोफेशनल टू टेल द पेरेंट, बिकॉज पेरेंट विल नॉट हैव opposite का cards or they will not have different items and flash cards to tell ki this is this concept, and more or less the child will not sit also with them at home to understand all these concepts. So the best way to teach them is during daily routine, how the same concepts can be taught to the children. Then location on the table next to the plate. So see, we are targeting prepositions also. In the meal time, एक खाना खाने के time पे you are targeting nouns, verbs, adjectives, prepositions and so many things that you need not think about sitting and teaching the child separately. During the bath time, again you can target the nouns, the body parts. There are actions that you can target. There are adjectives that you can target. Then location, सोप कहाँ पड़ा है, पानी बाल्टी कहाँ है, all these things, towel कहाँ है. So simple questions are also coming. कहाँ है में prepositions are also coming. The child can say that the soap is on the shelf. तो on the shelf तो वो prepositions भी उसमें आ रहा है. Time concepts, अभी नहीं नहाएंगे, बाद में नहाएंगे, पहले आप जाओ, अभी नहीं, later. So all these things are very important. And these concepts are coming to the child. And then water concepts, like ये सिंक हो रहा है, फ्लोट हो रहा है, स्प्रे all these are different verbs that you can teach to the child. Then during getting dressed, जब आप खाना खाते समय, नहलाते समय, आप पढ़ते समय जब आप दिखा रहे हैं, तो all these nouns and major body parts you can teach. Then other body parts and actions such as pull, tie the button, sit down, put your shoes on, prepositions. So all these concepts can just be targeted using your daily routine activities. This is what we have to counsel the parent as a professional, because we should realize that whatever resources we have with us as a professional may not be available to the parent, and at the same time the parent may be at loss कि वो घर जाके उनको कैसे सिखाएं, and some parents are too hard pressed for time that they will not go searching for things here and there. So this, the best way is आप speech and language stimulation बोलते हैं, so you can actually divide it into different daily routines that the parent can target and teach the child according to these concepts. Once you are clear with the concepts of normal speech and language development, then you can tell the parent also कि okay, this age में ये concept उसमें आ जाना चाहिए. So that is why it is important that the profession should be very thorough with the normal speech and language development, so that a child is neither missed and neither misdiagnosed.
Like you have told about the different aspects of development of speech and language normally in a child, और उसमें आपने डिफरेंट स्किल्स के बारे में बताया. हमने स्टार्टिंग से देखा अभी तक की अपने डिस्कशन में कि किस तरह से लिसनिंग स्किल्स इंपॉर्टेंट है, कॉग्निटिव स्किल्स इंपॉर्टेंट है, रिसेप्शन और जिसको कि हम कॉम्प्रिहेंशन भी कह सकते हैं, इनपुट, जो कि हियरिंग, नॉर्मल हियरिंग एबिलिटीज़ होती है इंडिविजुअल में, तभी एक प्रॉपर इनपुट दिया जा सकता है. उसके बाद प्रॉपर प्रोसेसिंग ब्रेन में होना बहुत ज़्यादा ज़रूरी है, जिससे कि वो इंटरफेयर कर सके कि पर्टिकुलर सिचुएशन में जो भी स्टिमुलेशन दिया जा रहा है उसका क्या मीनिंग है, और उसको एसोसिएट कर सके ताकि एक प्रॉपर अच्छा आउटपुट बच्चा दे सके. ये हमारे एक्सपर्ट ने बताया. और उसमें हमने देखा है कि एक प्रॉपर सिक्वेंशियल डेवलपमेंट, एक अगर हम बच्चे को लेते हैं कि जिसका एज है 2 years या 3 years, तो एक माइलस्टोन्स का डेवलपमेंट किस के अकॉर्डिंग होना चाहिए, और 1 month में बच्चे को क्या अचीव करना चाहिए, 2 months में. बट ऐसा नहीं है कि स्ट्रिक्टली हमें उसको फॉलो करना चाहिए. अगर कुछ डिस्क्रिपेंसी होती है, कोई ऐसी प्रॉब्लम होती है, तो पेरेंट्स को जो है प्रोफेशनल्स को कांटेक्ट करना चाहिए, और प्रोफेशनल्स को प्रॉपर इन्फॉर्मेशन देना बहुत ज़्यादा ज़रूरी है, ताकि एक अवेयरनेस हो सके, एक ऐसा लेवल मेंटेन हो सके कि पेरेंट्स ध्यान दें अपने बच्चे पे, प्रॉपर स्टिमुलेशन देने के लिए एनवायरनमेंट में. ये हमने देखा आज के जो भी हमारा डिस्कशन था रिगार्डिंग डेवलपमेंट ऑफ स्पीच एंड लैंग्वेज. और मैम आपने बताया कि अगर प्रॉब्लम होती है कि अगर हम एक टाइम पीरियड के बाद बच्चे में डेवलपमेंट नहीं होती है, तो किस तरीके से हमें एक डायरेक्ट इंटरवेंशन देना बहुत ज़रूरी है, विद द हेल्प ऑफ द प्रोफेशनल एंड द पेरेंट्स ऑल्सो, विद ऑल्सो द इन्वॉल्वमेंट ऑफ द चाइल्ड. दैट वॉज the today's topic of discussion regarding speech and language development. This is time for the closing of our session. Thank you so much.